Welcome back to the Caribou Data Science channel. This is the evening of September 25th, 2020. I just want to give you a quick review of a report I ran earlier. It was for the COVID-19 statistics for the state of Maryland. I also want to point out briefly here also that the two different ways that the numbers are being reported and why it's important for you to know which ones you're being showed and why you're being showed them. So here's my script for today. I'm using R programming language combined with the ggplot data visualization package, and I'm also reading the data from RSQLite database, which contains the data for today's report will come from the New York Times state database, COVID-19 database. Let's just kind of walk through this right here. You can see here that the report itself is actually, you can actually view the USA's report on this website right there. Okay, so the first number is, we look at the cumulative numbers. Now, you have to understand about cumulative numbers is that they always go up. Cumulative numbers always go up, except they can also flatten out, but they can never go down because they're cumulative totals. You add yesterday's totals into today's totals, and the total for today into the total tomorrow. Okay, so if you're a gloom and doomster, if you want to say, you know, we could have done better, well, even if we'd done better, this plot may not change. Okay, because if the rate of increase remains the same, even if the numbers shrink, the line is still going to go up. So here's the cumulative cases for Maryland, and here's the cumulative deaths for Maryland. Once again, this huge spike up here in May, but good news is coming. Okay, so I'm going to tell you, and that's why you have to make sure. This way you have to be careful when you see these numbers. Let's take a look at some daily cases and deaths. Here's the cases. Spike back in April, everybody had that. Everybody had a decline following. In June, it began to decline again. July, you can see July. But from here on down, it's basically downhill. There's a decline in cases, a level off. Now it looks like it's going to continue down. My friends, that's good news. That means that you people in America, if you're people in Maryland, that means that what you're doing in Maryland, wearing masks, uh, practice social distancing, self-isolation when possible, is making a difference. This tells us this chart tells us that you're making a difference. The cases are declining. Take a look at deaths. Look at deaths. Deaths that you had one spike of deaths back in May, and it's been down ever since then. Even this line, the daily line, is declining a little bit. My friends, I'm going to say it again. The sacrifices you are making in Maryland is having a positive effect on the COVID-19 numbers in Maryland. Let's take a look at it a little different way. Well, this here is the mortality rate, and I'm using the simple method that Johns Hopkins University is using. I'm dividing the number of deaths by the number of cases. Okay, and this is just to give a sort of a litmus test. I mean, it may not be the most accurate, but does give us some idea of what's going on. This number is the average number of is the average death rate, the average mortality rate. Look at this. The mortality rate is staying below 2.5% almost the whole time. That's not bad considering when before you were up to 5% just a few weeks ago. All right. Let's take a look at some monthly numbers now. Actually, we look at some weekly numbers first. Now, see, you don't quite see the. You still see this one big trend down here. Okay, and this week certainly will not catch last week. So the decline is resuming for cases. Look at this weekly totals here for deaths. It's a steady downtrend. This number here is 50. So far this week you haven't even had 50 deaths. You had less than 50 deaths for the previous 2 weeks. Okay? The sacrifices you are making again is working. Let's get some monthly numbers. Let's finish with some monthly numbers. Okay, so here's cases. In all probability, September's cases will not catch August. Even taking into effect that, September has one less day in August, it still will not catch August numbers for cases. Now, there's a pretty good chance that with 3 or 4 days to go, you may not even catch uh, August deaths. And most certainly will not catch July's deaths. Again, this is positive news. This is very good news. Let's see if you can bring that death in under August's death. You have 1, 2, 3, 4, 5 days to go. It's going to be close, but you can do it. You can do it. Okay. So that takes care of this little brief report for Maryland for today. Again, the news is very good for Maryland. Keep you know keep at it. Keep wearing a mask. Keep practice social distancing and self isolation when necessary. And the numbers will continue to fall. The numbers will continue to fall if you continue to practice those three things. Thanks so much for your time this evening. I hope this has been an encouragement to you, particularly if you're from Maryland. And also, go out and check out that link for the report for the U.S. for today. The report's updated every day, so keep keep up on it. Don't let the media fool you into thinking that what you're doing is not doing any good. Okay. Thanks so much. We'll catch you later.